This is WRAL News at 7 with special coverage of coronavirus. Facts, not fear.
We're flattening the curve, and fewer people are getting sick at the same time. Because we acted early and because we acted together, we have averted the devastating scenarios we've seen playing out in other parts of the country.
To protect our health and long-term economic prosperity, we have to act with care rather than haste.
Looking forward with optimism and caution. Today, state leaders unveiled the path forward. Good evening, and thanks for joining us. I'm Deborah Morgan.
And I'm Gerald Owens. Thank you for joining us. As we come on the air tonight at 7 o'clock, we can tell you North Carolina is inching forward with its response to COVID-19. You're going to hear a lot about testing, tracing, and trends. 3 areas leaders say we need to improve on before easing restrictions. Starting with testing, Health and Human Services Secretary Dr. Mandy Cohen is working with public and private labs to make sure it is widely available across the state. Tracing, where do cases originate? The state plans to boost the public health workforce to help trace who may have come in contact with a patient and when.
And trends, what we've all monitored, which populations are impacted and where. This data will help guide policy decisions, including either relaxing or strengthening social distancing. And while we continue to see a rise in cases, fewer people are becoming sick, as Dr. Cohen pointed out, which is a good sign. Today, Wake County did report its first death, an 81-year-old man. We are currently under 5,300 cases across the state, with 139 deaths statewide and 431 people hospitalized across North Carolina. Once we have improved on testing, tracing, and trends, the governor stressed the virus would still be a risk until we have a vaccine. Until then, he gave us all an idea of what we can expect the new normal to be once we start reopening, and more importantly, how we must all tread lightly to get there.
Experts tell us it would be dangerous to lift our restrictions all at once. Rather than an on-off light switch, think about it more as a dimmer switch, which can be adjusted incrementally. As we slowly bring the lights back up, we have to monitor for troubling signs of a spike in cases that could overwhelm our hospitals and risk lives. So getting this right, testing, tracing, and trends, is the most important step.
Some of the specifics the governor mentioned would be wearing masks, limited crowd sizes in restaurants, and no in-person crowds for sporting events or concerts. We want to stress no restrictions have been lifted at this point. Governor Cooper says this will be done via new executive orders, which would not come until the end of this month.
Today, we also learned additional face masks arrived in North Carolina, and more N95s are on the way. FEMA's shipment of N95 masks is expected to arrive before the end of the week. State Emergency Management Director Mike Sprayberry also says 2 shipments of face shields arrived today. The Coronavirus Task Force daily briefing at the White House is just wrapping up. Mark Boyle's in the live center, keeping an eye on it. Mark.
Gerald, good evening. Some of the takeaways from the president here within the past few minutes is his big phone call tomorrow with the governors on potential reopenings of the state. Take a look at your screen. Here are some of the bullet points. That briefing just wrapped up, as I mentioned. So the details are expected to be rolled out tomorrow during the president's briefing. That's what he said this afternoon. And then the governors will detail their individual state plans. It's not going to be all of the governors, all of the states. It'll be somewhere between 20 and 25, according to the president. He also outlined some of the latest numbers that we're seeing as well, and says that we could be on the road to recovery in terms of the downward slope. It's still a long way to go. We'll monitor things as they develop tomorrow. And again, the exact states that will open before May 1st, the president has not announced those. All those details are expected to be rolled out tomorrow.
Thank you, Mark. 12 workers at UNC Medical Center in Chapel Hill tested positive for COVID-19. WRAL confirmed this with health officials at the hospital after receiving a tip from a nurse concerned about the safety of frontline medical workers there. The nurse says they are having to reuse surgical masks for 5 12-hour shifts. UNC says they are doing so in accordance with CDC guidelines. The nurse spoke to WRAL with the condition of anonymity, fearing repercussions. We altered the voice to protect privacy.
I think the leaders of UNC have failed the staff who are taking care of these patients at the bedside. The physicians are not the people that are taking care of the patients.
The nurse is also concerned the hospital is still using shared rooms for some patients. UNC Health confirmed that is the case, but only for 9 beds in a rehab center. A spokesman said they have taken significant steps to ensure coronavirus is not brought into that area. The other big story of the day, the stimulus money. Millions of people received that cash today, prompting overloads on several banking websites and apps.
You sent us your questions. Now we hope to answer some of them. Local financial planner Gerald Townsend is joining us live on Zoom. And Gerald, thanks for being with us. We would normally be talking to you today about tax day, but not this year.
Not this year, Gerald. Usually you'd be having a story of frantic last-minute filers. Today with the extension, it was too calm. It was an eerie feeling today.
Oh, they were frantic, but for other reasons.
Right.
The first question applies to many people.
Other reasons.
Yeah, is the stimulus check subject to an income tax? A lot of people had this question. Can it be taxed either at the state or federal levels?
The good news is no, it is not subject to tax. So that's a nice one.
Well, Gerald, this question now applies to families with college-age students. And this is a quote here for the question. Why didn't my child get money, or why didn't I get money since I claim them as a dependent?
I think this has been one of the biggest head scratchers out there. We get this a lot. To be able to get the $500 per dependent payment, the child, the dependent, has to be under the age of 17. That means 16 is the highest age. Now you think, wait a minute, they're 18, they're 19, they're in college. I'm still claiming them on my tax return as a dependent. Aren't they my dependent? Well, yes and no. They're your dependent for income tax filing. They're certainly your dependent in a practical sense. You're supporting them. But there are different definitions in the tax code for what dependents are, a qualifying child. Mm-hmm. And the definition that this particular economic rebate is using is a definition of a qualifying child, which is really for purposes of some other tax credits, that has to be under the age of 17. So you end up with kids really in a economic no man's land where they're claimed about their parents as dependents, but they are, say, 18 or 19. The parents don't get the payment. The child themselves may have some income, say, from a part-time job. Again, the kid's, say, 19. The child is filing their own tax return, but because they're still a dependent, because they're not truly independent yet, they also cannot qualify. So that's just the way it is.
All right, this one combines tax returns and stimulus checks. Many people are still waiting for their tax refunds. Mr. Berkowitz asked this question. He wants to know why he may not have received his tax refund, even though he filed it 7 weeks ago.
They're just picking on him personally, Gerald. It feels like that, I know. No, I don't know, obviously, exactly. It could be that when he filed, he did not do direct deposit. You know, maybe he was getting a paper check sent to him. That always delays the process. It could be that the IRS is just simply overwhelmed processing refunds and also doing this other stuff. Maybe they're overwhelmed. It could be there's some issue on his tax return where that's being questioned or estranged or something like that that's slowing it down. Really no way of knowing right now.
Gerald, you told us that the stimulus check money is not taxable. Let's now move to the federal unemployment money that started rolling out today in North Carolina on top of state benefits. If someone does not want to owe taxes next year and doesn't necessarily need the added $600 from the federal government, is it wise not to accept the federal unemployment money?
I usually have one rule. If someone from the federal government ever shows up at your front door and says, I have money, do you want it? The correct answer is yes, thank you. So I don't know any reason not to accept it. If you pay taxes on the unemployment money, okay, you still have something left, right? So yeah, I don't know any reason I would not accept the money if you're qualified to receive it.
Oh, I always say yes to someone who's offering you money.
Yeah.
My parents told me that. Well, Gerald Townsend, local financial planner. Listen, we're going to be checking back with you after a quick break. We're going to talk about small businesses and their situation and concerns that you're hearing from them.
Plus, testing for COVID-19 at your neighborhood pharmacy.
This is a major game changer in terms of the fight against COVID.
Coming up, David Crabtree speaks with the president of the National Association of Chain Drugstores about the new guideline changing testing as we know it and why we are not seeing it in North Carolina just yet.
This is WRAL News special coverage. Facts, not fear.
Back now on WRAL. Go ahead.
Yes, and we are back live now answering your questions with local financial expert Gerald Townsend.
Yeah, Gerald, in addition to the stimulus checks, which are the big story today, you're still hearing from small business owners and working with them as they try to recover. What are their biggest concerns?
Well, many of them in small business. There is a program as part of this CARES Act called the Payroll Protection Program. That is a loan that a small business can get to basically cover about 2.5 months worth of their payroll cost. And the neat thing about it is if it works correctly, it is a forgivable loan, which means at the end of it, you don't have to pay it back. And not taxable either. The frustration in rolling it out has been is you go to your bank to get it, but the bank websites that process the applications have been, I guess, overwhelmed. So it's been very frustrating for small businesses. I would say hang in there because the bank websites are now seeming to open up a little better. You're also getting certain non-bank lenders, such as, let's say, a PayPal or a QuickBooks or firms like that are now getting in the business of also doing these loans. So I would just say hang in there. I think the processing will get better.
And quickly, Gerald, I have one last question for you. Within the past hour, we heard from a widow, and on her own, she makes about $40,000 per year. That goes up to $90,000 with her husband's pension. Would she qualify for the stimulus check?
It does not sound like it. If you take the 40 plus the 90, and it's a widow, so she's filing as an individual. And so 90/40 is 130,000. And so with individual filers, when you make above 75,000, they start phasing down the refund. And by the time you get up to 99,000, you're not eligible. So she's over the 99,000.
Gerald Townsend, thank you so much for your time and expertise and insights into all these questions.
Sure. Thanks for having me.
And if you are looking to still have your questions answered, we have a full list of the most common questions and answers on WRAL.com.
Just now into the Live Center, Durham County releasing its new numbers in terms of COVID-19 across the county. The total number right now, 376. 27 new cases here this evening for those who've tested positive for coronavirus. And they go on to talk about the 3 Durham long-term care facilities where there's been an outbreak. And this has been a problem for the Triangle specifically. Right in this area, we have seen quite a few. And in this release, they talk about where they are, the breakdown, the locations for residents and staff. Much more on this coming up tonight on Fox 50 and WRAL at 11 o'clock.
When we think about the front lines of the COVID-19 crisis, we think about hospitals and doctor offices, but also pharmacies are at the front line as well. Last week, the U.S. Department of Health and Human Services gave pharmacists the green light to administer testing for COVID-19. Steve Anderson is president and CEO of the National Association of Chain Drugstores, joins us from Washington to discuss what pharmacists are doing now, what they may be able to do in the future. Steve, thanks for taking the time to talk with us.
Sure, David, thanks for the opportunity.
First big thing here, this idea of pharmacists being able to test. While I know that's not happening yet in North Carolina, one, can you tell me where it is happening and if we might expect it here?
Yeah, the Trump administration last week removed a major barrier in the fight against COVID-19. Secretary of Health and Human Services, Alex Azar, issued guidance that allows a licensed pharmacist to order and administer COVID testing of those tests that are authorized by the U.S. Food and Drug Administration. This is a major game changer in terms of the fight against COVID. We are also not only reducing regulatory barriers at the federal level, we're also doing it at the state level. And I really want to commend your governor in North Carolina that will bring this COVID testing by pharmacists to your state on the behalf of the people of North Carolinians. Now, the next big issue that we need to work with your governor and other people in public health is when the vaccine becomes available, that they will be able to get the vaccine administered by our pharmacists in our member company stores. So these are major, major developments because testing and vaccines are on the front of people's minds through this entire crisis.
We hear about testing still every day. Questions come into us. I want to stick with that for just a moment. So if you were able to be tested in a pharmacy, how quick would you know the results?
Well, it's important that your viewers do not walk into a pharmacy and look for the COVID testing right now. They need to go to the CDC website to see the criteria in terms of who can be tested. And then we would encourage your viewers, if they meet that criteria, to go to the website of the company who owns and operates their particular pharmacy to see if that company is administering the COVID test, and if they are, the procedures and the logistics to be tested.
Steve, at the beginning, we talked about doctors' offices and hospitals being on the front line, as well as pharmacists and pharmacies. What are you hearing? What are the doctors of pharmacy telling you about being on the front lines of this crisis now?
Well, I have to commend the pharmacists and all employees that work in our member companies, 40,000 stores throughout the United States. They are on the front line. They have been on the front line. The 155,000 pharmacists and the 3 million people that work in our member stores are doing extraordinary jobs. It's amazing the amount of appreciation we're getting. You know, you've seen those chalk drawings outside hospitals. We're seeing them outside of pharmacists. And, you know, a lot of times in a rural state like North Carolina, the pharmacist is the only healthcare provider in the community, and they are trusted. And people seek advice. And during these highly stressful times of high anxiety, there's comfort in the advice and guidance that they get from pharmacists. So, you know, if we can get to this issue of testing and vaccinations by the pharmacists who the people of North Carolina trust, I think it'll have a huge impact as we move forward to fight this insidious virus.
Well, we know there's intensive work going on at Duke and UNC regarding a vaccine. Hopefully there will be a breakthrough, and testing hopefully will be in North Carolina with pharmacy soon. Steve Anderson, President, CEO of the National Association of Chain Drugstores, thanks for your time.
Thank you for the opportunity, David.
Today's chill prompted a frost advisory for most of us overnight tonight. Meteorologist Kat Campbell is here with a quick look at your forecast. If you plan to be outside tomorrow morning, Kat, it's going to be brutal.
It is going to be frigid tomorrow morning. Get back out your winter coats. Temperatures could fall as low as 34 degrees tonight. Everyone under this frost advisory. This lasts from 2 to 8 a.m. tomorrow morning. Temperatures will start to climb, though, quickly throughout the day tomorrow. We're going to be in the 50s around lunchtime. High temperatures climb into the low to mid 60s tomorrow afternoon. The difference between today and tomorrow, it's going to be a little bit warmer tomorrow, and we have the sunshine with us all day long. Back to you.
All right. Thanks, Kat.
Today's update from Duke nurse Ashley Wheeler comes from an area many of us may have seen outside of the hospital.
Today's been pretty busy. Everyone's doing a really good job. The workload has been pretty heavy. Still don't usually have folks waiting in the lobby, but all of the rooms are full and we're still using all of the same staff. It's just, a lot more work in each individual room. Everybody's doing a really good job keeping up and helping each other out. There's been a lot of overlapping. If somebody's in a room in their PPE, either using their face mask or a powered air respirator, then it's not necessarily super fast to get out of all that and go into another room. So people are helping each other out to get our workups done. Earlier today on one hall in particular where it's really busy, it looked like a subway station with people coming in and going out and all just kind of flowing around each other. It's, we're all doing okay. Everybody's seems pretty comfortable and happy today. In general, we're not really scared of getting sick. I think for us, we're maybe a little bit worried about bringing things home to our family. A lot of us have kids or sick family members or folks who would not do well if they got the virus. So we're taking precautions. I go straight to my mom's house and get completely changed and leave everything in the car, and I don't take anything into my home, essentially, except for me. And, you know, otherwise we're doing pretty good. My son asked me yesterday what 2 things I miss the most about all this, and I said baseball, and then I said baseball again, but he plays baseball and we have been missing it a lot. But then I kind of revised my answer and said, I really miss not having to think about a virus all day long, because it's been weeks on end, and I think we'll be doing it for a little bit longer, but everybody's doing a good job. Keep up the good work. So this is our respiratory tent that they've put up. It's 3 separate rooms. There's the front room, this middle treatment area, and then this is a clean area where we have supplies and x-ray and other things. Rebecca is working here today. This area, they've got really nice air conditioner, and then they've also, of course, thank you, North Carolina, we've had to also use like 5 tanks of propane heat in the last 2 days. What is it like working out here?
It's interesting, but it's much different than inside. Kind of feel like you're in the middle of war times, being in a tent when there's a hospital right inside.
Right.
But it's the best for the patients to try to keep them as separated as possible so everyone can stay healthy.
Oh, we thank them, and thank you for watching WRAL.
Our next newscast, 10 o'clock on Fox 50. Have a good night.